now close your eyes. All right, smell this. What does it smell like?
Kind of like rubber.
Okay, and then take your finger away, close the other nostril. Okay, eyes closed, smell this. Okay, can you smell that?
No.
All right, so if the patient reported that they could not, that could be a problem with the olfactory nerve. Okay, so number 2 is optic, and I would ask him to read something. So keep in mind that optic is the ability to read, to actually see, and oculomotor is the ability for the eyes to move and to also test pupil reflex. Okay? So I would ask you to read that sign that's not the top one, but the second one.
2011 BATA Quiz Bowl Champions.
Okay, and is your vision blurred at all?
No.
Okay, good. All right, now we're going to test oculomotor. So for the oculomotor, when you start testing the eyes, it's really super easy to test all of them, all the motions of the eye at the same time. So keep your head straight, okay, and follow my finger only with your eyes and not your head. Ready? Okay. Good. Okay. So pupil tracking is part of what your oculomotor nerve does. It also does the ability of the eyes to cross, okay, and pupil reflex. So I can also pull out my little pen light here, okay, and I want you to just look straight ahead. Okay, and I can look for bilateral symmetry, not only in the pupils, but in the constriction and then in the dilation. Okay, so oculomotor. Then we have trochlear nerve. So the trochlear one does upward eye rolling, which I already checked because I went not only side to side, but I went up and down. Okay. Trigeminal is both a motor and a sensory nerve. So for trigeminal, you would ask the patient to clench their teeth. Okay. The muscles that operate your jaw essentially. So go ahead and clench. Good. Okay, close your eyes for a second. Does this feel the same on both sides? Does this feel the same on both sides? And does this feel the same on both sides? Okay. So the trigeminal also innervates your face, so you want to check sensation then. Abductions is a nerve that makes your eyes move side to side, so I already checked that when I did his pupil assessment. Everybody remember seeing that, right? Yeah. Abductions, A. Okay. Next up is facial. Okay, so for facial we have taste and also facial, what am I trying to say? Muscles of expression. So I would just have the patient smile. Okay, and personally, practically speaking, I think it's a bad idea to put anything in the patient's mouth, so we're not going to check gag reflex, like by putting something in their mouth for them to gag on. I'm also not giving them anything to eat, but as a suggestion, if you're really concerned about this, you could have salt and sugar and have the patient taste them and see if they could differentiate. So taste, okay, is a facial nerve function. Okay, vestibulocochlear, we're going to check both balance and hearing, so could you stand up for me, please? Okay. And stand on either foot. No, face the class. I'm going to stand here because I feel like I can catch you better. Okay, so lift up one foot. Awesome. And put that one back down. Lift up the other one. Okay, just a quick screen to see how well balanced they are. You can have a seat. Now for hearing, I want to stand behind the patient.
What?
Huh?
What?
For hearing, I'm going to stand behind you.
What?
Yeah, that was good. Okay, for a longer haired patient, one of the simplest things you can do is take that hair, like if it's hanging down beside their ear, and just rustle it. Just do like this. I doubt he can hear this. That's a really, do it to yourself if you have hair around your ear, just like crinkle it a little bit. It's kind of loud. All right, and again, you're going to check bilaterally. So I can do this. Which ear can you hear this in? Right or left? Okay, how about now? Okay, how about now? Okay, sometimes you guys try to be patient, right? So check to make sure they can hear equally bilaterally. All right. Next up, we have glossopharyngeal. So I would ask the patient to say ah. Okay, pharyngeal muscles, so the ability to speak. Again, glossopharyngeal also is the ability to taste, but I am not going to check that. And then vagus is next. So vagus, we could test the gag reflex. We could also test the patient's ability to swallow. So say we said ah before, now we're going to swallow. Okay. Then spinal accessory innervates the traps and the sternocleidomastoid. So I'm just simply going to do, for the spinal accessory nerve, I'm just going to do the upper traps manual muscle test. So ear to your shoulder, please. Okay. Hold it right there. Good. Ear to the other shoulder. Hold it right there. Good. All right. And the last one is hypoglossal, so go ahead and stick out your tongue. Okay. So what I'm looking for here is a deviation from one side to one side or the other. So if the tongue comes out, it's normally straight, that's fine. But it could deviate to the left or deviate to the right. Okay. All right. So that's